did everything. Then I was elected as mayor, and my very first meeting I was chairing, I thought, I don't remember a single thing that the mayor did before. So I expect this is going to be kind of like that. So we'll see how it flows. But anyway, we have staff that'll make sure we keep on track. So with that, I'll call the Thursday, August 22nd, Little Hoover Commission meeting to order. And we don't take roll or anything. I can't recall. Say first.
We do not.
Okay. All right. So with that, I guess we'll start with the public comment, 3 minutes per speaker. So I guess we'll start that.
Correct. Thank you, Mr. Chairman. So we will move into public comment. Public comment is limited to 3 minutes per speaker, 30 minutes total. Speakers who make public comment will be heard but will not be seen by the commission. If you've joined via Zoom, use the raised hand feature in Zoom to let us know that you wish to make public comment. If you have phoned into the meeting, send us an email immediately at littlehoover@lhc.ca.gov. That address is on your screen. Please give us your phone number so we know who to unmute. And we may also have people who wish to make public comment at the physical location of the meeting. So again, if you've joined via Zoom, use the raised hand function. If you've phoned in, email us at littlehoover@lhc.ca.gov immediately. And public comment is limited to 3 minutes per speaker. And so with that, we'll start with anyone who's in the public noticed location downstairs. Shara, do we have anyone who wishes to make public comment there?
We do. Jennifer, you can go ahead. Thank you so much. Good morning, Chair, Commissioners. My name is Jennifer Fearing, and I am the Sacramento advocate for California Association of Nonprofits, otherwise known as Cal Nonprofits. And we are a policy alliance of close to 10,000 nonprofit organizations across the state of California, really that operate in every sector, serving communities up and down the state. And I am just here to comment positively on the study proposal that is described on page 26 of your background information document. We're thrilled to see this. Cal Nonprofits, along with 550 other individual nonprofit organizations a couple years ago, sort of wrote an open letter to the governor and legislators calling for what we call our nonprofit equity initiative. And it is to improve a variety of contracting practices that the state utilizes when contracting with nonprofit partners for all kinds of services or for grants for projects that are really causing inequity. There is inconsistency across state government in contracting practices that leave a lot of organizations out because they don't necessarily have the capacity or capital to, for example, front resources to the state and wait for reimbursement. Indirect costs, we're not adequately compensated for the cost of our sort of existing as businesses to be partners. We're not paid promptly. The state's Prompt Payment Act exempts certain nonprofits from being paid on time. A whole host of issues that we have then been pushing for through a package of legislation. And in particular, your study proposal highlights advanced pay, where we were successful last year in getting a permissive, so the authority that state government agencies now have to provide up to 25% pay in advance. But because it's permissive, there's a huge implementation effort that needs to be made across government to try to ensure access to this important contracting practice. So we were very heartened to see the description of the study proposal and would encourage the commission to move forward with that. And also, as appropriate, Cal Nonprofits and our partners would be happy to be willing kind of partners in executing on that work. So I'm here, I can answer any questions folks have, but just very excited to be here today and encouraged at the prospects. Thank you.
Thank you very much, Jennifer. We will move on to anyone who, I believe there's no other, Shara, there are no other people in the physical location to make public comment, correct?
That's correct.
We'll move on then to raised hands. Go ahead, Shara.
We have no raised hands.
And I believe we also have no emails. So, Mr. Chairman, I think we can close out the public comment portion of the agenda and move into item number 2, which is the approval of the minutes from the business meeting of May 23rd, 2024. Those begin on page 2 of the packet.
Okay. Do we have any comments or do we have a motion to approve those minutes?
So moved.
I'll second.
Okay, we have a motion and a second. I'm assuming we take roll on this. Like I said, I apparently wasn't paying attention to every other meeting.
We do, Mr. Chairman.
Okay.
Legally, we must take a roll call on everything now.
Okay.
Chairman Nava, Vice Chairman Cannella,
Aye.
Commissioner Arner,
Aye.
Commissioner Byer,
Aye.
Assemblymember Chen, Commissioner Garcetti,
Aye.
Commissioner Hernandez,
Aye.
Commissioner Johnson,
Aye.
Senator Min, Assemblymember Ortega, Commissioner Sidley,
Aye.
Senator Welk. Motion carries, Mr. Chairman.
Okay.
So if we can move on to item number 3 on the agenda, that is approval of the minutes for the business meeting of July 25th. Those were sent to you on Monday by Tamar as an addendum to the packet. My apologies, they were not included in the original packet. So, but if we can take those up, the minutes of July 25th.
All right.
So,
We have a motion.
so moved.
Commissioner Erner. I think Commissioner Byer said second, but he's muted, so we'll go ahead.
Yeah, second.
Okay,
All right, we have the roll call.
thank you. Chairman Nava, Vice Chairman Cannella,
Aye.
Commissioner Arner,
Aye.
Commissioner Byer,
Aye.
Assemblymember Chen, Commissioner Garcetti,
Aye.
Commissioner Hernandez,
Aye.
Commissioner Johnson,
Aye.
Senator Min, Assemblymember Ortega, Commissioner Sidley,
Aye.
Senator Welk. That motion also carries, Mr. Chairman.
Great. All right. I think the next item is 3, consideration of draft report on implementation of past commission recommendations regarding Denti-Cal.
Correct. Thank you, Mr. Chairman. So this is part of our ongoing effort to do more work following up on the implementation of past recommendations as called for in the Commission's rules of procedure. This draft report begins on page 5 of the packet, and I'm going to ask Ashley, who was the principal author, to provide a brief summary. So Ashley, if you can summarize this for us.
Perfect. Thank you, Ethan, and thank you, Vice Chair Cannella and Commissioners. Last fall, staff initiated a review to track progress on implementation of the Commission's recommendations in its 2016 study of California's Medi-Cal dental program, known at the time as Denti-Cal. The original study was prompted by a worsening epidemic of rotting teeth, especially among children. The review exposed a dysfunctional dental care system with excessive bureaucracy that hindered access to care. In 2017 and again in 2018, the Commission followed up with additional recommendations to improve access to and administration of this important program. With this most recent review, we sought input from key state leaders and stakeholders to assess the state's efforts to improve the program over the past several years. This draft report provides new data and examines implementation across 3 key areas: improving access to care, alleviating administrative burdens, and bolstering prevention efforts. We found that of the recommendations made in the Commission's initial report 8 years ago, 1 was fully implemented, 7 were partially implemented, 1 was not implemented, and progress on 2 could not be determined. State leaders have made significant efforts to improve the Medi-Cal dental program, including through administrative changes and a multi-million-dollar prevention initiative. Despite these efforts, California still ranks among the worst states for pediatric dental disease. This underscores the critical need to further strengthen the Medi-Cal dental program and ensure all Californians, especially our most vulnerable populations, have access to quality, affordable care. This report, while noting important advancements, serves as a reminder of the work that remains. Thank you, Commissioners.
All right.
Thank you, Mr. Chairman. So turn it back over to you for Commission discussion and a motion if the Commission wishes to approve.
Any comments or questions or?
Mr. Chairman, this is
Yes.
David, and I'm not sure about whether Commissioner Arner and Commissioner Sidley were around 8 years ago, but I know I was. Commissioner Nava has been an exemplary leader on this topic, and he has been persistent in following up on multiple occasions. What we discovered in our initial report was a completely broken system that was very poorly managed, and policy efforts to fix it were kind of stalled. And an initial report and a follow-up report by the commission, I think, jump-started some substantial progress. Having said all that, and again, stressing Commissioner Nava's leadership on this, the report to me is disappointing in that we're calling some things partially implemented, but we're still in an atrocious position on dental health for children, millions and millions of children. And it's shameful where California is relative to the rest of the country. And so I view the follow-up report as something that ought to require the executive branch and the legislature to pay more attention to this kind of shameful healthcare situation for disadvantaged youth in the state. Dental care is related to overall healthcare in important ways. It can be related to employment. If you have bad teeth, it can be a big factor in not getting jobs. There are a whole series of consequences, and I'm not sure the state has yet put the focus on management and resources necessary to get the job done. So I congratulate the staff for doing the report, but just express frustration that we're still kind of stuck.
So I was around 8 years ago just in the legislature, and I remember this was my first exposure to the Little Hoover Commission, working with the commission on this issue. And it was pretty shocking, really. For example, patients with Down syndrome, they found it easier just to pull the teeth of these patients rather than do the proper medical care, which you can imagine adds all sorts of other issues. So I don't disagree with you, Commissioner Byers. So what would you like? I mean, how would you modify the report? Would you be stronger in the rebuke, or?
No, I think it's really going to be empowering you and Commissioner Nava to do pretty aggressive outreach with your friends in the legislature and in the executive branch, saying, guys, the job is not done. And at least initially, I think there was a sense that perhaps it was the executive branch leadership over this program who said some offensive things, and we followed up on that, and that person's no longer in state government employment. But I don't think it's just a leadership question.
No,
It's a kind of an attention question, attention and intention.
Yeah.
Mr. Chairman, Commissioner Sidley has raised her hand.
Oh, Commissioner Sidley, sorry, I'm trying to pay attention to everything.
No, that's so great. It's good to see you running the meeting, and I'm sorry that the chair was not able to attend for some personal reasons. I was here 8 years ago, and it was one of the more disturbing studies, and I was sort of just came in and started hearing about what was going on, and I think candidly disgraceful what we heard. So I echo what Commissioner Byer has said, and I echo what he is indicating is we have to continue to push the legislature to pay attention to this and try to fix the situation. I mean, it is similar in many ways to what we learned, I think, about the care for many of our disabled citizens and the challenges there. And so I think the Little Hoover Commission has a key role, and I'm proud to be a part of that key role to push for solutions. So thank you, David, for speaking up, and I agree with what you said. Thank you.
All right, Commissioner Aaron?
Yes. Good morning, everybody, and hope Pedro and everything is okay in Santa Barbara. Having said that, so what I remember of this issue, right, because I was not on the commission at the time, but it was an issue from the legislature when I was in the legislature. And we have to remember what the components of this program, what the components are, right? There's the state administration. I think it's probably the Medi-Cal division, because Denti-Cal is part of Medi-Cal. I'm presuming it's the Department of Healthcare Services still. Okay, I'm looking at
yes.
But the eligibility for it is done by the Department of Social Services because they do the Medi-Cal applications and covered California and all of those kinds of things, right? But what I remember as being the bigger problem, and I remember actually visiting with dentists in my district, right, who had contacted me willing to take Denti-Cal patients, but we're going to take them free because the payment mechanism is so horrendous, and I presume it still is. I don't know if we've talked about that in our study, but we need to, right? The reimbursement rates are so low, and the amount of paperwork is enormous, and dentists simply cannot handle that. And so I remember visiting their dentists they were periodontists, children's periodontists. Okay, this is in Richmond, California, who literally were coming into a dental clinic on Saturdays, right, on their off days, to provide care to children who have presentations in regarding to their dental. And they did it free because it wasn't worth it to them, right, to reply for the few dollars they were going to get, let alone go through the paperwork hell that they had to get it. And so, you know, I'm hoping that we've got to be able to say to the legislature, the reimbursement system is not working, and it hasn't worked for 20 years, everybody. This is not a new issue. As you know, we're going way back to 2014, I think, to our first study. And nothing has changed. I mean, I know incrementally and all of that, but I bet you if we looked at, as I think that Vice Chair Cannella said, it's embarrassing that we haven't improved at all when you look at other states that have obviously figured out how to make this work. And so the question becomes one of when is the legislature going to own up to the issue of they've got to change rates here in order to ensure that dentists will take it. But I'll just never forget the Department of Department of Healthcare Services came to testify on this issue. And when we asked them about access, they said, "Oh, there's no problem with access." And their idea of no problem is every dentists are literally their applications are in to work within the Denti-Cal system, right? They're all signed up for it, but nobody's taking it because it's not worth it to them to take it. And it's not that they're not good-hearted folks. It's just that the system doesn't work for them, and they're the provider of care. It's not that, you know, state administration is not the provider of care. And so there's got to be something done with the dental community to figure out what's an appropriate reimbursement rate so that they can participate in the program willingly as opposed to doing something voluntarily on the side because they don't know what else to do.
All right, Commissioner Garcetti.
Thank you. I was not on the commission, obviously, back then, but I want to bring it up to date a little bit here with the personal experience. I was honored some years ago by having my elementary school named after me, and I try and help them whenever I'm able to. And just in June, I asked, you know, what are the biggest issues for you that we might be able to look at together? Food was number one, very poor community. Food was number one. Two was dental work. They said, these kids have never been to a dentist, ever. And you can just look at some of their mouths and they need dental work. They're desperate need. And three was just general health care. They hardly any go to the doctor unless it's an emergency. So I'm in the process of trying to find some help there working. I'm reaching out to both UCLA Dental School and USC Medical School or Dental School to see what they can do. But for me, with one school, that doesn't solve anything in terms of the problem. When I asked the principal, did you know about the state services? She vaguely knew about it, but said none of the parents know, and most of them don't speak English. So there's some huge issues here. So I hope that the commission and then certainly the chair and co-chair or assistant chair, vice chair, whatever you call it. Sorry.
I call it the co-chair.
There's a co-chair, and I like that. Continue to move forward on this because this is a desperate situation for so many families.
Okay, so I guess, are we okay with the report as written then? And then the next step is, I've heard the commission say they would like Pedro and myself to reach out to the legislature and work with them, which I'm happy to do. If we have a goal, I'm happy to meet with whoever over there to advocate for this. So, but the first step is the approval of the report.
So moved.
We have a motion, Commissioner Byer.
I'll second.
Commissioner Sidley, second. All right, roll call.
Mr. Chairman, Mr. Vice Chairman,
Aye.
Commissioner Aaroner,
Aye.
Commissioner Byer,
Aye.
Assemblymember Chen, Commissioner Garcetti,
Aye.
Commissioner Hernandez,
I'll abstain.
Commissioner Johnson,
Aye.
Senator Min, Assemblymember Ortega, Commissioner Sidley,
Aye, yes, sorry, I muted myself.
Senator Wilk. That motion carries, Mr. Chairman.
All right, next up, item 4, project and meeting schedule.
Yes, Mr. Chairman, I would move there to sub C, selection of future study topics, and refer the commission to the memo which begins on page 22 of the packet. This follows up on the discussion at the last business meeting to provide a sort of wide lens for a potential subcommittee to work with. We broadened the analysis in this memo to include various ways in which state government partners with outside organizations, including traditional public-private partnerships for infrastructure, public philanthropic partnerships, which have grown recently, and even state grant making to nonprofits. That was what Ms. Fearing was talking about earlier in public comment. We outlined 2 potential studies to be done in sequence, with the details to be determined by the subcommittee, of course. The first would deal with ways in which the state can receive funding from outside partners. Those would be things like traditional public-private partnerships, public philanthropic partnerships. The second would address ways in which the state can provide funding to outside partners. That builds on our work in intimate partner violence, where we already made a recommendation for advanced funding, and that recommendation was approved by the legislature, was implemented by the legislature. Because both of these studies would focus on how government can more efficiently partner, I also believe that both of these would serve as sort of a test run for our previously proposed series of studies on governmental efficiency. That proposal was for a series of distinct, shorter studies to be done over time, perhaps intermittently. And I think these studies could begin that series, or they could simply stand on their own. So with that, Mr. Chairman, turn it back to you for commission discussion.
All right, any discussion on this item?
Sure. Again, David, I'm very supportive of this particular proposal, in part because I think it will enable us to serve a larger purpose, that is to educate members of the executive branch, the legislative branch, the press, civil society about the differences in public-private partnerships. In other words, it's a phrase, but it's not very well understood. And it covers a lot of different things, $20 million projects, $5 billion projects. And I think by teasing it out and comparing what's happened in California to what's happened both at the federal level historically and in other states, we can learn a lot. So for example, in New York State, they use public-private partnerships for all manner of activities, bridge and tunnels, subway systems, etc. In Orange County, they used it for creating a new toll road. And so everything in American history tells you that there have been these public-private partnerships, but exactly how they have been established, what the scale is, how they're governed, how transparent they are, how it's necessary to protect against conflicts of interest. There are a lot of questions that would benefit from research and then hearings. And so I think a big part of the study is essentially saying to the staff, please spend some time doing desktop and research and interviewing people who are expert at this, as opposed to what tends to be our pattern of having public hearings, maybe sometimes before we've done all the research. In this case, we're kind of switching the order, and that's a good thing in the long run, I think, for the commission.
Okay, Commissioner Sidley.
So I'm also very supportive. I mean, as you know, it was sort of my suggestion to take a look at this. I am, happy to see how you've broadened it. To build on what Commissioner Byer said. I seem to follow along with Commissioner Byer, but I'd really like to, if we go forward with this, I'd like to have a hearing with maybe many of the foundations and hear the troubles that they've been having and concerns. I think that it's important to have those concerns aired and to have them out on the table so that we actually have a relatively good idea about maybe how to make suggestions to fix that. And so the best way to learn is to desktop. I think, David, is important, but I think also boots on the ground and hearing what people are saying and experiences. And again, I know that like the Milken Foundation would be very happy to participate. Many of the other foundations would be very happy to come and testify about challenges where they've wanted to be involved. So I just wanted to add to what David is saying and just say I would be very supportive of boots on the ground, people coming in and sharing challenges where they've wanted to partner with the state and have found that it's been difficult. So, but I'm supportive of the study. Thank you.
Great. Commissioner Hernandez?
Definitely supportive, and as Commissioner Sidley mentioned, definitely want to make sure that the foundations are part of the initial process. I mean, I've had a chance to work with them, and yes, I mean, it is possible, but they have to do very creative things to work with the state, and they shouldn't have to do very creative things. So happy also to provide additional background to staff or commissioners in terms of some of the things we've done.
Any other comments? All right.
So is the proposal to look at how foundations try to relate to the state in regards to public-private partnerships? Or because as I looked at the notes just now, or are we going beyond that? I mean, the state of California has thousands of contracts with outside providers, thousands, right? Where the state is the funder, all right? So whether or not that comes under the definition of a public-private partnership, it certainly is not what I had imagined a public-private partnership looks like. Because in a partnership, and usually I think in the public and private, the private is probably also putting up some money, right? Not just the state of California, but the other part of the partnership. And so, you know, I guess, how broad do we want to be? It's one thing to look at the contracting provisions of the General Services Agency or whatever it's called this week, because it's the one that most of these contracts go through, which is one of the places where they get stuck, to be honest with you, because their perception of what a contract should be and what the service delivery system should be might be different than the originators of the proposals. So, but I'm just, you know, asking for some idea, you know, some idea of how large a study we're doing, or are we really focusing on those folks that really want to do what I call true public-private partnerships, where they're putting some money on the table as well. Money or in-kind services, whatever you want to call it.
Commissioner Erner, I think that goes back to exactly what David's point was, is first define it.
Yeah.
And so I think that that's part of what we need to do. What I don't think it is just regular contracting. Right. I think it honestly is, how do we incorporate what you've described, if it's money, if it's ideas, if it's in-kind contributions, if it's infrastructure, if it's AI. I mean, how can third parties, non-governmental entities participate with the state, and, you know, to not have to jump through crazy hoops and be creative in order to be a true partner? Is it a true P3? You know, where Commissioner Byer talked about building a roadway that people are paying to use in Orange County, or is it something else? So but that's what I mean, when I had envisioned and sort of made this recommendation on a broad scale, and then the staff has put it on paper and made it look like something real. It is not just contracting with the state. It is. Right. It is the third parties. How do they participate? What can they do? But I do think, to David's point, let's define it, and define it for the state. And, you know, certainly I turn back to Jose, who has worked in this area and knows so much about what's going on and the challenges. My perspective was just, I was at a meeting and people were like, God, we want to participate, particularly in the energy sector. And we just don't know how. Here we are, we're trying to be zero emission across the state. We're trying to do as much as we can. And there's all these ideas and people want to participate, hydrogen, et cetera, and they don't know how. So I think we can do a tremendous service to the state to examine this area and help by defining and then giving people a roadmap to and maybe streamlining how they can participate. So that's what I think the study is. I don't think the study is just contracting with the state.
Mr. Hernandez?
Just to add to that, I mean, I think it'd also be beneficial examples of how to contract. I mean, you brought up hydrogen. Arches is a great example of a public-private partnership that was created. And it was a long process, but it was created. And that's the whole role, is to bring in industry, bring in investors, and partner with the state.
Okay. I mean, Ethan, do you think you have direction, or?
I think that we do, Mr. Chairman, and to some of those comments, it would be entirely consistent with the commission's traditional practice for the commission to approve the idea, which I think is laid out in the memo with some specificity, and then for the details to be determined by the subcommittee working with the staff. So to drill down even farther, the commission can certainly do that now as the full commission, and that's fine if that's what you wish, but it would be entirely consistent with past practice for the subcommittee to determine exactly what the parameters are. Do we do one report or two reports or three reports, how we divide those up and so forth. Those are often decisions left to the subcommittee, and then of course it comes back to the full commission at the end. So I think that we do have direction that's laid out in the memo, and we will take into account, of course, the comments that have been made today and move forward if the commission wishes us to.
Okay, do we need to have a motion in a second, or just?
Yeah, I think we probably, again, legally, we are supposed to do everything by roll call now with the remote meeting. So I think ideally, if the commission is willing, we would, the best practice would be a motion in a second.
Commissioner Sidley?
I'll move.
Okay, we have a motion. We have a
Second.
Second by Commissioner Byer. We'll have the roll call.
Mr. Chairman, Mr. Vice Chairman,
Aye.
Commissioner Aaroner,
Aye.
Commissioner Byer,
Aye.
Assemblymember Chen, Commissioner Garcetti, Commissioner Hernandez,
Aye.
Commissioner Johnson,
Aye.
Senator Min, Assemblymember Ortega, Commissioner Sidley.
Aye. Yeah. I'm good. I thought I was muted again. Sorry.
Senator Welk. That motion carries.
Well,
Mr.
Commissioner
Chairman.
Garcetti was muted. Can you call his name again?
Yes, Commissioner Garcetti.
You're still muted. There you go.
Aye, sorry.
Thank you. Thank you, Mr. Chairman. Mr. Chairman, we can now move on to the next item on the agenda, which is an administrative update. We really don't have an administrative update at this time. There's no particular administrative developments. The last thing that I did want to report on is the implementation report, and there I'll just focus on the bills that we are supporting. We took a support position on 13 bills this year that would implement our recommendations. Some of those died along the way, and then of course some died on suspense. The appropriations committees took up the suspense file last week. 8 of our bills survived off of suspense and are still in the process. 3 of those deal with our organic waste report, 1 with our customer-centric government report, 1 with intimate partner violence, 2 with labor trafficking, and 1 with the developmental disabilities system. We can run through details on those bills if you wish, but I think suffice it to say that we will obviously continue. We've sent support letters to the appropriations committees. We will continue to advocate for those bills as they work through the rest of the process. But the fact that we got 8 off the suspense file is pretty good, I would say.
Yeah.
So we will continue to advocate for those bills as the session wraps up here over the next couple of weeks. Happy to answer any questions on that, Mr. Chairman, but if there are not, and I don't see any, then we have actually completed, appreciate the very quick meeting today. We have completed the agenda for today. We have another meeting scheduled for September 26th, which will be a remote meeting. More details on that to come. And then we will be meeting in person in Sacramento on October 17th. Unfortunately, our location that we had previously reserved was taken from us, but we are scrambling around to find a new location. I appreciate Shara's hard work in that regard, and we'll be in touch with more details in due course to the commission. So if there are any other comments or questions from the commission, Mr. Chairman, happy to take those. Otherwise, I think we've completed the agenda for today.
So Ethan, do we know on October 17th, I'm showing on my calendar that the agenda is still TBD? Is that still an accurate statement?
It is, however, it will almost surely be the first hearing on the public-private partnership study,
Okay.
which you all just approved. So
Okay.
almost surely it will be, the subcommittee can iron out, which the chairman will appoint. Of course, we don't have a subcommittee yet, but the subcommittee will iron out the details working with us, and that will almost surely be the first hearing on that topic.
Great.
All right, any other questions, comments? All right, we'll adjourn the meeting. Thank you very much.
Thank you.
Great job, Mr.